Many critical health disturbances frequently and agonizingly experienced by women are tragically and consistently minimized, often subjected to what many victims feel is a systemic pattern of medical gaslighting, diagnostic apathy, and outright dismissal. This chronic failure in clinical recognition is not benign. It leads to severe delays in care. These legitimate, disruptive physical symptoms are routinely waved away in clinical settings as nothing more than simple, manageable stress, generalized anxiety, the unavoidable inconvenience of accelerated aging, or standard hormonal fluctuations. Yet, when these bodily disruptions cease to be isolated or episodic events and instead become aggressively chronic, stubbornly recurrent, or profoundly resistant to standard treatment protocols, they transition instantly from minor, unfortunate annoyances into unequivocal cries of critical metabolic distress. They signal a deep, fundamental failure in the body's energy regulation system, demanding immediate, rigorous, and highly skeptical investigation into underlying physiological cause, rather than mere symptom management. Today, we must move decisively past the superficial assessment of routine symptomology and the comfort of the easy, dismissive diagnosis. We must address the root cause of this systemic failure, the silent, debilitating structural flaw known as insulin resistance, IR. We will explore 8 distinct, yet profoundly interconnected biological signals that demand immediate and comprehensive clinical investigation. These 8 signs often serve as the earliest, most reliable indicators of severe underlying insulin resistance or the silent onset of developing type 2 diabetes. Recognizing these specific warnings offers a crucial, time-sensitive window for aggressive metabolic intervention before the disease progression becomes fully entrenched, chronic, and potentially irreversible, saving years of quality of life. 1. Recurrent vaginal yeast infections, candidiasis. One of the most relentless and disheartening health challenges directly linked to deep-seated metabolic dysregulation is the persistent, repeated, and seemingly untreatable occurrence of vaginal yeast infections, predominantly caused by the fungus Candida albicans. When episodes recur frequently, sometimes monthly, or flare up shortly after seemingly successful courses of potent antifungal medication, it is a critical systemic red flag that cannot be ignored or masked with over-the-counter remedies. This relentless pattern signals an internal environment perfectly ripe for fungal proliferation. Specifically, chronic and uncontrolled hyperglycemia, sustained high blood sugar. The connection is rooted firmly in biological ecology and chemistry. Yeast is fundamentally saccharolytic. It thrives exclusively on readily available sugar. Chronically elevated blood glucose levels do not just raise systemic blood sugar. They create a hypersaccharin bloodstream and a localized tissue environment that is essentially an all-you-can-eat microbial feast for opportunistic candida throughout the body, critically including the mucosal membranes of the vaginal ecosystem. Furthermore, sustained high sugar exposure severely compromises the body's innate immune response, particularly impairing the motility and efficacy of neutrophils, our frontline defense cells responsible for engulfing pathogens. Locally, this sugar surge critically disrupts the delicate, protective acidic pH and balanced lactobacillus bacterial flora of the vagina. This double blow, aggressively feeding the pathogen while simultaneously weakening the host's primary defense mechanisms, establishes a vicious, painful, and often agonizing cycle of infection and relapse. If you are struggling with chronic, hard-to-treat yeast infections, seeking a comprehensive metabolic workup including fasting blood glucose, fasting insulin, and HbA1c testing is paramount for addressing the systemic fuel source. 2. Polycystic ovary syndrome, PCOS. Polycystic ovary syndrome, PCOS, is globally recognized as the most common endocrine disorder impacting women of reproductive age, potentially affecting as many as 1 in 10 women. While it presents through classic and highly disruptive hormonal symptoms, such as irregular or absent menstrual cycles, oligomenorrhea or amenorrhea, persistent difficulty with conception and fertility, and overt signs of hyperandrogenism, like excess, coarse hair growth known as hirsutism, cystic acne, and male pattern hair thinning. PCOS is fundamentally a metabolic condition. In women with PCOS, the body's peripheral cells develop a state of pronounced cellular deafness, failing to respond adequately to the signaling from insulin. To overcome this critical communication breakdown, the pancreas works relentlessly over time, secreting massive amounts of insulin into the bloodstream. a state termed hyperinsulinemia. This significant excess circulating insulin acts directly upon the ovaries, where it aggressively cross-reacts with receptors designed for insulin-like growth factor 1, IGF-1. This potent endocrine crosstalk dramatically accelerates the ovarian production of higher than normal levels of potent androgens, male hormones. This critical metabolic malfunction dramatically accelerates the risk of developing type 2 diabetes. Current epidemiological data suggests that a staggering 50% to 70% of women diagnosed with POS will progress to frank, irreversible diabetes by the age of 40. Consequently, the cornerstone of effective POS management must be the aggressive optimization of insulin sensitivity, treating it as a crucial preventative measure. POS is not merely an infertility issue. It is a major predictor of lifelong cardiometabolic disease. 3. Frequent urinary tract infections, UTIs. While most women experience a typical UTI at some point, a distinct and highly concerning pattern of high frequency, or infections that are unusually resistant to standard courses of antibiotics, should never be dismissed as a simple anatomical inconvenience. Recurrent symptoms warrant immediate investigation into underlying metabolic health, not just further cycles of escalating antibiotic prescriptions. The physiological link is a direct consequence of the kidney's compensatory efforts during sustained hyperglycemia. The kidneys are sophisticated blood filters, but once blood glucose levels exceed their maximum reabsorption capacity, they are forced to excrete the massive excess sugar via the urine, a process called glucosuria. This glucose-rich urine effectively transforms the entire bladder and urinary tract into an ideal, nutrient-dense culture medium. A persistent, sugary, all-you-can-eat buffet for bacterial pathogens, most commonly uropathogenic E. coli. This microbial feasting dramatically increases the likelihood of chronic infection, makes subsequent infections harder to fully eradicate, and often leads to rapid and painful relapse when antibiotic therapy is withdrawn. Chronic, untreated UTIs in this metabolic context significantly heighten the risk of severe upper urinary tract infections, known as pyelonephritis, which can lead to sepsis and acute kidney damage. Immediate and rigorous glucose control is demanded to starve and sterilize the urinary environment, thus breaking the cycle of infection. 4. Distinct skin changes. Acanthosis nigricans and metabolic distress often broadcasts its presence through highly visible, specific dermatological changes, serving as a palpable, visible manifesto of internal hormonal chaos. The most critical skin sign to recognize is acanthosis nigricans, and this condition presents as dark, velvety, and thickened patches of skin, typically concentrated in the body's deep, warm, natural folds. The armpits, the groin, the nape of the neck, and sometimes under the breasts or on the knuckles and elbows. These dark patches are frequently misinterpreted as a simple issue of poor hygiene, friction, or obesity. They are, in fact, a powerful, visible biomarker of critically high circulating insulin levels and severe underlying insulin resistance. The biochemical mechanism is straightforward. The overwhelming presence of excess insulin, hyperinsulinemia, binds directly to growth factor receptors, specifically IGF-1 receptors, on skin cells. This binding acts as a potent growth stimulant that triggers the rapid proliferation of epidermal skin cells and increases pigmentation, noticing and should serve as an immediate catalyst for a comprehensive metabolic panel. 5. Chronic, unrelenting fatigue. We all experience occasional tiredness, but the fatigue associated with metabolic disruption is profoundly different. It is chronic, crushing, debilitating, and completely unresponsive to rest. This deep, debilitating sluggishness stems not from simple exhaustion, but from a fundamental failure in efficient cellular energy utilization, essentially an internal power outage while the main generator runs outside the house. When insulin resistance is present, the key hormone, insulin, cannot effectively unlock the cell doors to allow glucose, the body's primary fuel source, to enter the cells for energy production within the mitochondria. The usable energy remains trapped uselessly in the bloodstream, contributing to high blood sugar, while the body's core metabolic engines, particularly muscle cells and vital brain tissue, are effectively starving for necessary ATP, cellular energy. This results in a persistent state of chronic metabolic exhaustion, forcing the body into perpetual mode. For women suffering from this type of unrelenting fatigue, attempting to solve it by relying on constant caffeine, highly sweetened energy drinks, or quick sugar fixes only compounds the issue, leading to temporary, exaggerated spikes followed by even more severe and agonizing blood sugar crashes. The critical first step is eliminating refined sugars and processed carbohydrates to physically resolve the internal fuel blockage and restore optimal cellular energy pathways. 6. Numbness and tingling, diabetic neuropathy. The presence of persistent numbness, tingling, a severe burning sensation, or the painful feeling of pins and needles, paresthesia, in the hands and feet is a profoundly serious indication that sustained high blood sugar is actively damaging the delicate peripheral nerve fibers throughout the body, a condition known as diabetic neuropathy. This damage most often progresses in a predictable stocking glove pattern, starting in the feet and lower legs and gradually moving upward into the hands. Neuropathy is an extremely dangerous warning sign because the loss of protective sensation means that minor injuries may go entirely unnoticed. These traumas can rapidly deteriorate into severe, non-healing ulcers and deep tissue infections, potentially necessitating amputation if glucose control is not immediately restored. High blood sugar causes nerve damage through chronic oxidative stress and impaired blood flow, leading to the structural destruction of the protective myelin sheaths. These symptoms demand urgent effort, as nerve damage is often impossible to reverse. 7. Transient blurred vision. Sudden or fluctuating blurring of vision is a common, often frightening symptom experienced when blood glucose levels swing wildly. This temporary visual impairment is the direct result of a complex osmotic effect involving critical fluid shifts within the delicate structures of the eye, particularly the crystalline lens. When the concentration of sugar in the blood is excessively high, the body attempts to achieve fluid balance by osmotically drawing water out of surrounding tissues, including the delicate lenses of the eyes. This movement causes the lenses to temporarily swell and change shape. The swollen lenses lose their precise ability to refract and focus light correctly, leading to blurred or distorted sight, a temporary refractive error. While this effect is often reversible once blood sugar stabilizes, it is a clear and loud signal of severe systemic metabolic instability. If chronic hyperglycemia continues unchecked, this temporary osmotic damage transitions into permanent structural harm, leading to serious diseases such as advanced diabetic retinopathy and cataracts. 8. Frequent urination, polyuria, and excessive thirst, polydipsia. Frequent urination, medically termed polyuria, especially the disruptive need to wake up multiple times during the night, nocturia, is one of the classic triad hallmarks of severely elevated blood glucose. This uncomfortable mechanism results from the body's desperate attempt to purge itself of excess sugar through the renal system. As previously discussed, when the renal threshold is exceeded, the kidneys work aggressively to filter the high concentration of glucose from the bloodstream. To flush out this vast amount of sugar, the kidneys must pull large volumes of fluid along with it, a process called osmotic diuresis. This dramatically increases the volume of urine produced, leading directly to the constant, urgent need to urinate. This fluid depletion, in turn, triggers intense, excessive thirst, polydipsia, as the body attempts to restore the lost volume, completing a relentless feedback loop. Nocturia, in particular, severely degrades restorative sleep quality, which itself is known to acutely exacerbate insulin resistance the following day. Conclusion and call to action. These 8 distinct signs, often overlapping and usually progressive in nature, represent significant systemic failures in metabolic health that demand immediate attention. For women, recognizing these subtle symptoms is paramount because they often offer a crucial window for successful early intervention. If these signals resonate with your experience, seeking comprehensive medical evaluation is non-negotiable. Testing must move decisively beyond simple fasting glucose tests alone, as these often capture the problem too late. A comprehensive metabolic panel including fasting insulin, C-peptide, HbA1c, and an oral glucose tolerance test, OGTT, is vital for accurate diagnosis. Catching metabolic dysregulation early allows for aggressive intervention, often just lifestyle changes, targeted exercise, and weight optimization, to halt its progression and prevent severe long-term complications. We must reclaim control over our metabolic destiny and refuse to accept medical minimization. Thank you for prioritizing your health and seeking out this comprehensive information.